Good afternoon. My name is student Dr. Emma. I'm going to be taking care of you today, but first I'm going to get a brief case history for you. What is your name?
Alexa Gonzalez.
And Miss Gonzalez, how old are you?
I am 30.
30. What ethnicity would you say you identify with?
Hispanic.
And what gender would you identify with?
Female.
And Miss Gonzalez, what brings you in today?
Okay. I guess just for a routine eye exam, normally it's just blurry distance for far, blurry vision for far, sorry.
Okay. And would you say you've been noticing this vision in both eyes, one eye in particular?
Both eyes.
Both eyes. How long has your blurry vision been going on for?
So I first started noticing it when I was around 12 years old in school.
Okay. And do you currently wear any correction glasses or contact lenses?
Both glasses and contacts.
Both. Okay. How long have you worn both for?
Glasses when I was about 12 that I first started the blurry vision, and then I received contacts when I was like 15 years old.
Okay. And have you found, do your glasses or contacts help with this blurry vision you've been experiencing?
Yes.
They do. Okay. And would you say your blurry vision has gotten better since having worn them, or has it like degressed a little bit?
Throughout the years, it's slowly gotten worse.
Okay. When was the last time that you had an updated prescription, do you know?
An updated prescription, probably my last eye exam like a year ago.
Okay, perfect. And aside from this distance blurry vision, have you been experiencing any other complaints with your eyes I should be aware of?
Some dry eye.
Dry eye. And both eyes, one eye?
Both eyes.
Both eyes. Are you currently using anything to help with the dry eye?
Artificial tears, I use Blink.
Okay. Would you say your dry eye, is it constant? Does it come and go?
It's usually at the end of the day.
End of the day, okay. And do you have any discomfort associated with the dry eye?
Some moderate discomfort.
Moderate. Is there a certain time of the day where there's more discomfort than others?
By the end of the day.
Okay. And when would you say this dry eye kind of started for you?
I want to say about like 3 months ago.
Okay. And then have you been experiencing, besides the dry eye, any burning, itching, tearing, redness, double vision, any flashes or floaters?
No.
Nope, none of those. Perfect. And let's talk a little bit more about your eye health history. You said you had your last eye appointment about a year ago. Was anything discovered during that eye exam?
No, just updated my prescription.
Okay, perfect. And do you have any past eye disorders or diseases I should be aware of?
I did have an eye infection about 2 years ago, and I was given some antibiotics for that.
Okay. Have you experienced any trauma or surgeries to your eyes?
I have not.
Perfect. And then we're going to shift gears to kind of more of your overall general health. But when was the date of your last physical with your primary care doctor?
It was about 3 months ago.
3 months ago? Did they discover anything at this physical?
They said my vitamin D level was a little low.
Okay. Did they prescribe anything for you? Or just kind of let it be?
They told me to buy like the over-the-counter vitamin D pills, and I take about 1 a day.
Okay. Do you happen to know like the dosage on that?
I can't remember off the top of my
That's
head.
okay. That's okay. And do you have any past surgeries or traumas that you've experienced?
I did have my appendix removed when I was 16.
Okay. And for medication, so you said you're on this over-the-counter vitamin D supplement. Are you currently on any other medications?
Birth control.
Okay.
And like I see artificial tears for the
Oh,
dry
yes.
experience. But that's
And
about it.
you said that was Blink, correct? Blink
Blink,
tears.
yeah.
Perfect. And then in terms of your family and their ocular health history, does anyone in your family have any type of eye history I should know about?
My father did have glaucoma.
Okay,
My mother had a retinal detachment,
okay,
and my grandmother from my dad's side had cataracts. She had cataract surgery a few months ago.
okay. How's he doing? Or she? How's she doing?
Pretty well.
Good, good. And then for overall your family health history, anyone in your family have any medical conditions?
Yeah. So my mom has high blood pressure, osteoporosis, and she also had a hysterectomy about maybe like 8 years ago or so. And then my maternal grandmother also has osteoporosis, like my mother, and she also has high cholesterol. And
Okay.
then my maternal grandfather was a type 2 diabetic.
All right. And in terms of your social history, do you partake in any tobacco use?
No,
How about any alcohol use?
I drink socially.
Okay. How much would you say that you drink? Just kind of like here and there, not really once a month,
Once, twice a month, maybe.
once or
Not
twice a
too
month. Okay. Do you partake in any recreational drugs?
No.
No. And do you drink any caffeine?
About 1 to 2 cups a day.
Okay. Do you have any allergies to medications?
Penicillin.
Okay.
I have trouble breathing.
Mm-hmm. And then any other reactions that you had to that penicillin besides difficulty breathing?
Sometimes I do break out in hives.
Okay. Do you have any other allergies besides the penicillin?
Seasonal allergies. I get like a runny nose, stuffy, the usual.
Yes. Perfect. And then just a little bit about kind of your occupation and your hobbies. What do you do for a living?
I'm an art teacher.
Oh, fun. What grade do you teach?
Middle school, so 6th through 8th grade.
That's fun. And when you're not at work, what do you like to fill your free time with?
I like reading, hiking, and like I'm an art teacher, so arts and crafts every now and then.
Yes,
Why?
definitely. Well, it sounds great, Ms. Gonzalez. Thank you. I'm gonna go review this with my preceptor and then we'll be right with you.
Thank you so much.
You're welcome. I have Ms. Gonzalez, a 30-year-old female who is Hispanic, and she came in today complaining of blurry vision at distance in both eyes. She has had blurry distance vision for about the last probably 15 to 18 years or so. She started wearing glasses about 15 years ago, and then she kind of switched over to contacts. And that's definitely been helping. But last year at her last eye appointment, she had an updated prescription, and she's noticed since then it's definitely gotten worse. So might need an updated prescription today. She also has complained about some dry eyes going on, also in both eyes. She's been using some artificial tears for that. I think the Blink brand she's been using. This started about 3 months ago, and there's just some moderate discomfort, but otherwise she has been fine, but definitely wants to kind of look more into that and see if there's a better solution than over-the-counter drops. She's not been experiencing burning, itching, redness, pain, discomfort, diplopia, flashes, floaters, none of that, thankfully. Like I said earlier, her last eye appointment was a year ago, just an updated prescription at that time. She has had no trauma or surgeries to the eye, but she did actually have about 2 years ago an eye infection, given some antibiotics, and it resolved on its own. Her overall general health history, she had a physical about 3 months ago. At this physical, it was discovered that she is vitamin D deficient. So it was suggested that she takes over-the-counter vitamin D supplements to help bring up these levels. Aside from that, she has no trauma experience, but she did have an appendectomy about 14 years ago. Her family ocular health history is significant. Her dad has glaucoma, her mother had a retinal detachment, and her paternal grandfather had cataract surgery a couple weeks ago. In terms of her overall family health history, Her mother suffers from high blood pressure and osteoporosis, and she had hysterectomy. Her father is or not her father, excuse me. Her maternal grandfather has type 2 diabetes, and then her maternal grandmother has osteoporosis as well as high cholesterol. She does not partake in tobacco or recreational drugs. She's a social drinker, and she will have a drink maybe once to twice a month on occasion. She's allergic to penicillin. She had a reaction of hives and kind of difficulty breathing to that. She also has seasonal allergies, and she experiences runny nose with that. The current medications that she is taking is the over-the-counter vitamin D supplement. She was unsure on the dosage. She's also on a birth control. She takes that once a day, just like she takes the vitamin D supplement once a day. And she has been using the artificial blink tears as well for her dry eye. She is an art teacher, and in her free time, she enjoys reading, hiking, arts and crafts, and the patient was alert and oriented with person, place, and time.